So our speaker tonight is Andrew Campbell. He's an MD. He's the medical director of the Medical Center for Immune and Toxic Disorders in Woodlands, Texas, and the medical director of Chronic Fatigue and Immune Dysfunction Center in Houston, Texas. Both of these clinics treated patients from all over the world. Dr. Campbell was selected out of 720,000 licensed physicians to win the Patient's Choice Award 2009 to 2014. He also won the Most Compassionate Doctor Award 2011, International Health Profession of the Year for the Outstanding Contribution to Clinical Toxicology, Cambridge, England, 2005. Dr. Campbell is the editor-in-chief of several journals, including the Alternative Therapies in Health and Medicine, Advances in Mind-Body Medicine, and the International Journal of Complementary and Alternative Medicine and Natural Solutions. And Dr. Campbell will be talking to us about inflammation and toxins. Welcome, Dr. Campbell.
Is this on? Because you all stare at me and make me nervous. And it really comes from an unpleasant thing that happened to me in medical school. The first 2 days we sat in this great big flat auditorium, not with steps or anything. We all had to sit in alphabetical order, and there were a lot of us, and it was big hall, and my name being Campbell, I was up against the wall in the second row. In those days, they didn't have nice big screens like this. They had 35 millimeter slides and overheads, and that's it. I couldn't see most of them, so I had to borrow notes from everybody because this was orientation. What was going to happen during the next 4 years? That was important. And I said, you know what? From now on, I'm going to sit right in the middle of the front row. That's it. I'm going to get the best information the best way I know how. So the first day of medical school, you know how you're nervous, excited, and everything else, it's your first day. Okay. And I got there early because I got the middle front seat. And eventually the class filled in. And then the professor shows up with his crisp white coat, and he puts his briefcase on the table, and he looks around and points his finger at me and said, "You, stand up." Yes, sir. So I stood up. He says, "What's your name?" I said, "Andrew Campbell." He says, "Campbell, tell the class what are the causes of Hashimoto's thyroiditis." I was going to say something smart alecky like, you know, you got off on the wrong floor, or, you know, or what have you been smoking or something. But instead I said, "I don't know." So he said, "Sit down." He said, "Class, this is the first day of medical school, and on the first day, this is your first lesson. Never say you don't know, because people will think you're stupid. Instead, say you've forgotten, because then people will think you had more important things to think about." That's exactly what everybody did at me. Well, okay. A few weeks go by. He looks at me. He says, "Campbell, right?" I said, "Yes, sir." He says, "Stand up and tell the class what are the causes of ulcerative colitis." I don't know. I've forgotten. He says, "Sit down, Campbell." He says, "Class, this is a great tragedy for humanity. No one in the world knows what causes ulcerative colitis except for one person. And he's forgotten." What I'm about to present here for you, I've been presenting, I speak at about 25 medical conferences a year, all over the world. Well, not all over the world. Canada, the United States, Mexico, and Europe. And I'm invited to speak in front of groups of doctors, healthcare practitioners, etc. And I'm required to produce evidence-based medicine. Why? Because the great majority of these conferences are for continuing medical education credits. If you don't have evidence-based medicine, that hour is not counted. So you don't get invited again. What do I mean by evidence-based? It means it's supported basically in the medical literature, in medical textbooks, medical journals. Doctors throughout the world, doesn't matter where they're from, they could be from China, Germany, Austria, Belgium, Brazil, Greece, Iran, United States, Canada, who've shown that this actually works. They've supported it, and it's been accepted by medicine and science. Otherwise, the way it used to be, long time ago, before my time, was people would present whatever they wanted. It'd be kind of like reading Reader's Digest. I cured 200 people. I have this juice I squeeze out of this plant I grow in my garage. And 200 people got cured of XYZ. Okay. But in medicine, you can't do that. And let me tell you, it's easy to talk to people, but you know what's harder? TB. Man, when you've got those lights and you can't see anything, and those people are asking you questions, it's not pleasant. I've been on TV programs, 2020, Montel Williams, 24-hour investigative news, on and on. Those I really don't like. Doctors are great because at the end of the program, they'll do everything they can to poke holes into what you're saying. And if they do, you never get invited back. Since 1992, I've been invited back all the time. So that's the good thing. Take you through a trip here, because what's been found as the root cause of diseases. Who do I point this to? Hello?
Not clicking.
Nope. Oh, here we go.
No, try it.
Nope.
Might be a battery issue.
Batteries.
Your battery.
What type? If you just hit this one here.
Okay.
Left, right.
So, as you can see on this slide, pick the disease, and you've got at the heart of it inflammation. Just as an example, autoimmune diseases. It's 53 million Americans, 83 different autoimmune diseases. Cancer is 10 million. But we spend much more money on cancer than we do on autoimmune diseases. And I don't need to go into each one of these, but you get the point. It starts with inflammation. So how do we get there? So let's take it to the basics. The beginning of life. You're inside mama, and you're in a sterile environment. You get from mama what she puts in, drinks or eats, and if that includes over-the-counter medication, Tylenol, aspirin, and acid tablets that she chews, everything, including nutrients, oxygen, chemicals. If you're inside mama and she's behind a diesel truck for 10 miles and inhaling diesel particles, okay? And you give back fetal waste and carbon dioxide. Then birth. What happens at birth? Anybody here a mother? Who's a mother? Okay. What happens at birth? Your water breaks. Absolutely at the most inconvenient time or whatever, but the water breaks. What does it do? It's covering the birth canal very specifically, everything that baby's going to touch with an acidic environment. Why? Well, first of all, Candida, which is a mold, grows in that area. And so it prevents it from growing. It's acidic. So the first thing that goes into a baby's mouth are mother's microbes. And if you've ever, I've delivered hundreds of babies, and they're all covered with a waxy white coat. It's called the vernix. It's really helpful to keep bacteria off the baby, but nurses today wipe it off quickly to take baby to the mom so the first pictures can be taken. Go figure. But it's very good to have. Then, surprise, mother's milk contains bacteria, lactobacilli. These help break down a sugar found in milk called lactose. And this milk, for the first 3 days or so, is called colostrum. It's very good. It's very rich. It contains antibodies from mother. No, here, I got it. Thank you. And then after 3 days or so, it changes to regular breast milk, okay? More carbohydrates. But guess what? One of these carbohydrates is oligosaccharides. As you can read there, it's a long word. But baby can't digest it. So why? Well, because that's going to feed the bacteria that are starting to grow in mama and in the babies from mama. Okay? C-sections are getting more and more common. In the US, they're 20% approximately, depending on exactly which state you're in, of all births. But really, Europe is a lot less. Well, why? We're very practical people in this country. Oh, the baby's going to be born the first week of July. My gosh, that's right. No, I'm going to have it a week before so it doesn't mess with the 4th of July activities. The baby's due date is December 18th. Oh, no, 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 no. I know my OB-GYN loves skiing. He's going to be gone. I don't want his junior partner. So I'm going to schedule a C-section for 2 weeks before. Those kind of things. Now, there's a skeptical view mentioned in some journals that say it's because it's a lot faster. Doctors make more money, and so do the hospitals. All comes down to the dollar. Okay. So, what happens to the baby? There's no lactobacilli. Instead, first bacteria are those of skin, hospital personnel, and instruments from the hospital. How does that affect the baby? 80% more asthma in cesarean section. Double the risk of allergy to cow's milk. Increased risk of diarrhea and food reactivities later in life. So we're all born with an innate immune system. That's where the word innate comes from, okay? And we have to develop the second part of our immune system, the adaptive. The adaptive is the antibodies, the things that help us fight bad things and have good things, prevent bad things from happening and keep things good. So during the first 3 years of life, it's crucial. Why? Because this is the time where we develop immunologically, but also neurologically and metabolically, okay? And that sets the pace for the rest of our lives. No matter how old you are here today, it was those 3 years that started off. So by age 3, we have a microbiome, which we're going to talk about a little later, okay? And this lays the foundation for the rest of your life. And this is the time period when we're most affected by chemicals. Think of a child, okay? Think of how long it takes from the nostril and mouth to the lungs in a child. In us, it's longer, okay? Also, where do children live? On the floor or very close to it? We're further up, okay? All these little things that make sense, they're common sense things, okay? So, new carpeting, new this, new car, that new car smell, all those kind of things, those are all chemicals, okay? People hang little Christmas trees from their rear view mirror, chemicals, okay? But there's also chemicals in foods, And liquids we drink, those are called artificial coloring, artificial flavoring, artificial everything. They're not good for us. And they're especially not good when you're developing. So why did we get this way? How did we live before? You know, if this morning you had some wild boar with some wild onions for breakfast, that was probably pretty good. That's what you used to have. But today you had your poppy seed muffin. A lot of carbohydrates and sugars. Okay, so we got our food in the wild. There was no such thing as organic. It was all organic. There was nothing else. You ate foods in season. You didn't eat strawberries in winter. You ate what was most recently in the marketplace, what was picked right then, because that's all that showed up there. Okay? Bread was a big thing. We'll get into that in a little bit. We ate a lot of bread back then, but it was different. We're eating a hybrid today, for those of you who didn't know that. And the guy who made the hybrid won the Nobel Prize back in the 50s for making it, because everybody thought that was going to solve hunger in the world. How do we cook our food? We used microwaves back in the Middle Ages and before. We used all kinds of non-stick frying pans, right? No. We put a big pot over fire and threw a bunch of things and water into that pot. And when the pot was empty, sometimes you didn't even wash it out. What for? You're going to put stuff back in it, aren't you? Why not? We don't need to wash it. Let's just start all over. Pour some water and pour whatever we have in, and we'll make this big, nice, thick soup. Actually, tables were made with bowl-shaped indentations. And used to sop it all up with bread. Okay. What has changed? U.S. manufactures about 5 trillion pounds. That's a 5 with 12 zeros. Okay? And that's about the amount of dollars the government spends every other day, I think. But okay, so we make all those chemicals. But you know something? It's 70,000 different chemicals that make up this total, and only 1,500 have been studied for toxicity. Okay? Is there an imbalance here? Okay. We're exposed to gasoline fumes, diesel fumes. I came here on, is it 101? There's a bunch of cars out there. A lot of them. Fragrances, candles. You go into these candle stores, you smell those fragrances. And they want you to buy fragrances, but those are chemicals. They didn't put real vanilla bean or peach or whatever. Nah. Okay? What does a new car smell? Fire retardant. You ever fly on an airplane? Nobody's flown on an airplane. Every time you fly on an airplane is full of fire retardants. Okay? But it's also used babies' clothing, bedding, curtains. Why? Because if you remember, years and years ago, that's what used to catch on fire. We add a chemical called a fire retardant. They don't light up as quick. Okay, what else? Carpeting.
Pardon me, could I give you this wireless microphone? And
Thank you, sir.
All right.
All right, carpeting. By the way, all carpeting, most of it has under it another layer. But all this is formaldehyde. Remember the name. Okay, these are synthetic materials. They release this formaldehyde for a long time. It's not a week or two. Months, years. Then you also have building materials, plywood, gypsum, drywall, foam insulation, adhesives, all made with chemicals, right? Have you been to Home Depot, Lowe's, and things like that? Take a whiff. Okay. Cosmetics, toothpaste, perfumes, cologne, soaps, shampoos. These are all chemicals. Let's talk about BPA for just a moment. BPA, bisphenol A, all plastic containers. I used to love to buy Pompeii olive oil in the glass. It's now every oil comes in one of those plastic bottles unless you get the imported kind. So, I mean, that's just one example, but it's always something, you know, in plastic containers. What is BPA? It's neurotoxic. It's toxic to your brain. It's endocrine disruptor. It changes your hormones, not for the good, but for the bad. And by the way, they're now finally, oh, by the way, the government said no more BPA in things made for babies, okay? Like the baby bottles and the plastic bottles and the nipples and all that. They couldn't use BPA. So the industry got smart. They said, how are we going to get around this? We're going to make it change a couple of molecules, and now it's no longer BPA, so they can say this is BPA free. Instead it's BPE or F or W. They change it around a little bit. Dentists use it for composite material. It's linked to all kinds of diseases you can read. But what are the 3 common diseases in the United States? Cardiovascular disease, diabetes, it's a pandemic, and obesity. So, let's take BPA, Harvard. They took, and by the way, I'm from the East Coast. I was going to wear my coat and tie and all that kind of good stuff. And then I told my wife, this is going to be in Silicon Valley, so I'm going to wear a black mock turtleneck and jeans and stuff. And she says, no way, Jose. Okay. Harvard study, 75 volunteers, and it was published in this journal, JAMA, Journal of the American Medical Association. Anyway, 12 ounces of soup, vegetable soup, every day, okay? For 5 days. One group got canned vegetable soup. The other group got vegetable soup made with vegetables, and none of those vegetables came from a can, okay? They were real. So after the 5 days passed, they had a 48-hour washout where nobody ate any soup of any kind, okay? And then the 2 sides switched. The guys who got the canned soup now ate the other, and the ones who ate the fresh vegetable soup got the canned. So urine, eating whichever group ate for 5 days the canned kind had a 1,221% increase in BPA in their urine. Can you believe that? And there's a thing called Campbell soup. My God. Okay, detergents, surfactants, chlorine, phosphates, fragrances as well. None of those things are good. Again, I'm talking about chemicals, tetraethylene, which is used majorly by the dry cleaning industry. It's toxic to everything. Your liver, your brain, your kidneys, and it causes cancer. What else has changed? We use 2.3 billion pounds of pesticides annually. That includes parks, playgrounds, right? The lawn part in front of a big public building. Many people use it in their garden, around their home. And the problem is that a lot of these chemicals stay in you, okay? They stay in your fat cells, adipose tissue. They stay in your muscle, your bone, your semen, but only in men. Did you catch that? Okay, just checking. And brain, lungs, etc. So, what's the number one? I watched TV for a few minutes, and I saw an ad come up for Roundup while I was here yesterday in California. Roundup is glyphosate, okay? And glyphosate is the most used pesticide in the United States. We use more of it than the rest of the world combined, okay? And glyphosate residues are found on the main foods of our Western diet. We're talking about corn, soy, sugar, canola, wheat. Do you think that could have a cause of anything? Okay. And these residues inhibit, there's this, it's called cytochrome P50. It's an enzyme, and this enzyme's in the liver, and it helps you detoxify things because there's toxins everywhere, okay? Well, it prevents this enzyme from working, so you end up accumulating even more toxins, okay? So here's a graph. This is celiac disease. This is where people cannot tolerate any gluten whatsoever. One bite of gluten and you're very sick. Look at this incidence. This is when they started using glyphosate, and here it goes up, and this is just on wheat. Just on wheat. And look at the incidence. The line is glyphosate on wheat. The columns here, the gold-colored columns, is celiac disease. Do you see a correlation? Yeah. Oh boy. Okay. By the way, they used ICD-9 codes from hospital discharges to prove this. So no one could say this is fabricated. All right, second thing. Glyphosate on wheat. Now it's these gold columns, and here's deaths due to intestinal infection. Do you see a correlation? Deaths due to infection in your gut. Glyphosate again. What else? Here's glyphosate applied, the red line is applied to corn and soy, okay? The blue line is percent of corn and soy crops. This is the trend that was from before the 1990s. You can see it was here, and then it started to pick up, okay? This is the incidence rising, okay? And this is glyphosate applied by the 1,000 tons, not just sprayed on. Okay, what else has changed? We have new strains of wheat, rice, soy, corn. There was a study done, there was a professor from University of Minnesota. He went and with the National Autonomous University of Mexico in a near, between Mexico City and Veracruz, on land there, they decided to try this corn. Before, corn used to be knee-high. It was a very short head. Then they developed one that was shoulder-high, a big, tall head, full of grain. But when wind blew or storms came through, these would break and it would stop growing. So they said, we got to find a different one. So they found one that was hip-high with a great big head on it, and here came the Nobel Prize. So we eat more genetically modified foods than the rest of the world does. I know this food is organic except for the humus, but think of why do we have to actually ask for organic? Should be the other way around, don't you think? We put this hormone in milk. In dairy. Do you know that we can't sell a block of cheese or a stick of butter to Canada? Canada. Not that far. It's not another country. Because they don't accept anything in there. They want the pure stuff. You know, so it's in all this dairy. I wonder if you've been to malls on Saturdays and Sundays and seen children there. And you see these young girls that are age 9 and 10 and 11, and they're fully developed. And the American Academy of Pediatrics, AAP, is reducing the age of menarche. Menarche is when women go from being little girls to young women, when they start menstruating. It's typically been, always in medical books, 12 to 14. They're revising it to put it 9 to 12. So when a child, there's more to come. So, CAFOs, who knows about CAFOs? Any of you? Okay, we got some people who understand about CAFOs. So these are concentrated animal feed operations. What it means is that cattle, hogs, chicken, and turkeys are grown in these things, and the actual government definition, if you want to have a CAFO, is confined animals. They can't move around. And they're treated with hormones. They're given chicken or given arsenic. Why? Because when they eat the arsenic, it swells the stomach up. They eat more food. And they're sold by weight, right? A few more cents per chicken. And when you've got 1 million or so chickens, those few cents add up, okay? They put DES in beef about 1 week before they sacrifice the animal. They inject it with DES. DES is diethylstilbestrol. Diethylstilbestrol was a hormone developed by Abbott Laboratories back in the 1960s. It was given to women who were having threatened abortions, and their babies developed abnormalities in their genitalia. Little girls were born with fallopian tubes but no uterus, or uterus and a fallopian tubes but no ovaries. Little boys with undescended testicles, so on and so forth. So the government found out about this, and Abbott to this day keeps a registry of every child born until they die. Well, this DES goes in beef. Okay? It's a female hormone. So think about it. This female hormone in beef and the hormone in all dairy products, including cheese. So then these kids go and get a cheeseburger Happy Meal. What are they getting? And then a milkshake. What are they getting? You kind of follow this? And then ractopamine. I don't want to get too complicated, beta agonist, protein synthesis and all that. But what it does, it converts fat into muscle, okay? And it's given especially to pork, so they have less fat and more meat. It's banned in most of the world, not in the United States. Artificial coloring, preservatives, additives, sweeteners, we've talked about that. What other environmental factors are there? Molds and mycotoxins. Okay, there's over 100,000 species of mold, but only a couple dozen affect us humans. And we've known for a long time about these health effects. If anyone has ever read the Bible, in Leviticus, the Torah, the first 5 books of the Bible, Lord said to Moses and Aaron, I don't know, personally, if God says for me to do something, I think it's a good idea to do it. Okay, but what is it truly? He said, if you've got a growth on your wall, call the rabbi. He's going to come, he's going to put a mark where that growth is. And then everybody's going to leave the home for a week. And then a week later, the rabbi's going to come back and check this growth. If it's past his mark, everything in that house and that house have to be destroyed. It's no good anymore. It's a fabulous protocol that we should follow today. On my way down here, this 101, I saw a truck. Water and mold remediation. If you have a mold issue because of a leak and you ask 5 companies to come check it out, you'll get 5 different answers. I guarantee you that. It's not standardized at all. Okay. So in the Middle Ages, we had ergotism. We developed a medication out of that called ergot alkaloids, and they were used for migraines back in the 50s and 60s. Don't use those anymore. But this was from a mold that grew on rye bread. And people ate it. They had seizures. They had all kinds of spasms, diarrheas, paresthesias, mania, psychosis, dry gangrene, especially in the toes and fingers. Incidentally, of historical potential significance, potentially whatever, they're thinking that maybe the Salem witches thing was from this. Who knows? Okay. Not too long ago, there were 10,000 deaths in Russia in 1926, then 200 in England in 27, and as recently as 2001 in Ethiopia, but we don't have good numbers, but there were a lot. And in the 1920s, it caused, in Denmark and the Balkans, it caused fatal kidney disorders. And in 1930s, who reads a little history or knows, or did you all take history sometime or another? Oh, okay. 1930s, Ukraine, 30% of horses die from eating moldy hay. Horses were the pickup trucks and the trucks of their day. Today, we don't use horses to pull things and haul things. We use trucks, 18-wheelers, pickup trucks, and everything in between. Well, this caused a huge economic situation, and Stalin didn't like it. So he sent this young commissar to the Ukraine and said, you go find out what is killing 1/3 of the horses. Imagine if in this country, 1/3 of all trucks suddenly quit. Wow. Okay, so he went there and he found out that there had been several commissions that had investigated this. And the commissions consisted of veterinarians, agricultural people, et cetera, et cetera, et cetera. And when they couldn't come up with an answer, they were shot and replaced with a new bunch. And then that bunch was shot. And so nobody wanted to be part of any commission anymore to find out what was the reason of the problem. So this guy is young and smart, and he decided to go to the farms and check it out. And what did he find out? These horses were bleeding from their mouth and rectums, and they were eating moldy hay. He said, stop feeding them moldy hay. The problem stopped. He was made the commissar of the entire Ukraine. Later, he became a little more famous. His name was Nikita Khrushchev. Remember him? Banged his shoe on the UN. Okay, but he was smart. In 44, elementary toxic eleuthia. Why? Because people were starving to death. They would eat anything, including moldy bread. Okay, that's what happened. That was from a mold called Fusarium. The EPA, CDC say if something gets wet and stays wet for 24 to 48 hours, mold is going to grow. There's mold spores on this carpet, in this room, in your home. But you know, it's just like the little seeds in the packets you buy at the store because you're going to grow this plant or this flower. The seeds are in there. Nothing's going to happen to them until you put them in the ground in a pot or something, or dig a hole and put them in the ground, and then water them. Then they'll start growing. Same with mold, but 24 to 48 hours is all they need. Okay? And when they start to sporulate, they release spores all over the place. And the spores carry on them a mycotoxin. We're going to talk about that in a minute. But why are we having this problem now? Because before World War II, we used, what was used in homes? Plaster. It was labor intensive, but they used plaster walls, okay? It's alkaline, nothing grew on it. It's too alkaline. Lye, alkaline, okay? Then World War II happened, and then at the end of World War II, all these young men came back home to the United States, married all these young women, and they all played hide the weenie and had babies, okay? I'm a baby boomer. There may be a few in this room, I don't know. But the point is, we needed homes for these people. We needed to build them quickly and cheaply, and so that's where we developed drywall, okay? That's how that happened. That's why now. What other problem happened? For those of you who are old enough like me to remember, there was a crisis in 1973. It was called an oil crisis. We had these great big huge cars from Detroit. They got 2 miles to the gallon. And what happened? No more gasoline. Arab countries cut it off. What did we do? That's when the first Hondas arrived. They were little, they used little gas, etc. Toyota, that's when all that started. But the point is, the government, and its fabulous wisdom that only permeates Washington, D.C. area, said that we must build tight buildings. Buildings where windows don't open. Why? Because in the summer, if those windows are open, maybe the air conditioning will go out, and it uses more electricity, and electricity is generated by oil. And in the winter, we're going to heat oil to make heat, and if you have an open window, some of that heat's going to go out. So that's why we have these buildings built with two 2 doors to get into the building, et cetera. They're called tight buildings. And go into an office building in downtown, wherever, to one of these big buildings. Do any of the windows open? No. People seem to think it's because people would jump out then. It's not. Okay, so that's why now we have these things, okay? But the thing I want you to remember is these mold spores and hyphae induce persistent changes in inflammatory and immune response. And chronic exposure, because you're living or working in a place that has mold and you're not aware of it, you're going to have this changes in your immune system. And molds multiply very quickly, and they carry on them mycotoxins. These are secondary metabolites. So let me tell you about what are mycotoxins. Mycotoxins, well, let me take you to Sir Fleming, Alexander Fleming. He put 2 petri dishes on the windowsill, one with mold, penicillium mold, the other one with Staphylococcus aureus, staph. And then he went on a holiday. English take holidays, they don't take vacations. He went on a holiday, came back, and lo and behold, he noticed the staph was dead. He figured something from this killed it, and that's how he developed eventually penicillium. Penicillin from penicillium mold. That's why the name is like that. And we came into this huge aura where we gave antibiotics for everything. I mean, if you sneezed twice, you got an antibiotic. Okay? But if you've ever gone to your refrigerator and found something in the back and opened it up and found some green and orange spots on it and I don't know what else, and it looks funny, those are molds and bacteria. But the molds are producing mycotoxins to kill that bacteria because the mold wants that whatever for itself and doesn't want to have to compete for it, survival of the fittest. So what do mycotoxins are very toxic to humans. The most toxic substance known to humankind, and this is agreed upon in the world, all over the world, is aflatoxin. Comes from Aspergillus, common mold. What does it do? It causes cancer. Well, I'll show you in a minute. One of the problems with mold exposure, and I apologize for this being a little, it's easier for doctors to understand this. This is why patients start having complaints. They can't tolerate anything. Everything they used to use, now they can't tolerate. If you used a perfume or cologne or something, you now can't tolerate. Foods you can't tolerate that you used to eat before. Things that you used to do, now you can't do them anymore. So there's this change in the way you respond, and also you catch every bug around. If it's flu season, you're the first one to catch the virus and the last one to get off of it. You're catching everything. Your immune system is crawling on its belly. What else? A mold that produces a mycotoxin doesn't produce one and one. A mold can produce a whole series of mycotoxins. Second thing, if there's a mold growing in a home or in a workplace and it's known to produce a mycotoxin, believe me, those mycotoxins are being produced there. And just to give you an idea, it takes 500 degrees Fahrenheit, 30 minutes to destroy mycotoxin. And let me give you a size example. Hair is 100 microns. Okay? One hair. 100 microns. Mold is 10 to 20 microns. Mycotoxins are 0.1. So they get into the deepest parts of your lung. They get on the skin and can be absorbed through the skin. And they're on things, and you might sip a cup of tea or a cup of water a glass of water that's been sitting there, and the stuff got on it, and you're ingesting it unknowingly. What else? They affect every system in the body. And how toxic are they? The cancer of the liver from aflatoxin is with an up to 10-year latency. In other words, you got exposed today, and in 10 years, you'll develop it. Up to 10 years. Testicular cancer, but only in men.
Why is that?
I'm just checking, make sure you're following. Okay. And immune suppression. This is why these people, you start treating them, they can't tolerate anything. You give them a vitamin, you give them a nutrient, you give them a mineral. They come back and say, I can't take it. What are some of the names? Trichothecenes, ochratoxin, aflatoxin, citrinin, sterigamatoside, cysteine. I got a call one day from the head of the health department of the state of Oklahoma. He said to me, he's calling from his car. I could hear and he says to me, I need to send you a young girl because she has a serious problem and nobody in Oklahoma City at the medical center could figure out what she had. I was told by these doctors to send it to you. So she came to see me. She was 5 years old. She had fully formed breasts and fully formed pubic hairs, and she started menstruating. 5 years old. Do you realize the problem that mother had because she had other children? What does she tell them? I mean, there's huge consequences to this. Well, in asking and talking to the mother and digging through all the medical records, it came to light that the little school that she was in during the day had a mold problem, and out of 4 women that worked there, 3 had had hysterectomies in the last 2 years. Excuse me. Why couldn't a group of doctors in Oklahoma City, and I'm sure these were well-trained, well-meaning physicians, not see a little link? Oh boy. Okay. So then, here's just ochratoxin. It comes from 2 molds, very common, Penicillium aspergillus. Binds to human albumin. So some people are doing this urine test for mycotoxins. Well, if it's bound to human protein, albumin, it's our main protein, it can't be excreted by the kidneys. Stays in the blood. So don't do a urine mycotoxin test. It's worthless. Okay? And I know this is a little bit complex, but protein synthesis, it blocks you from making protein. And protein is number 1 for our bodies. We have proteins, fats, carbohydrates, okay? This is the protein that I'm talking about, okay? Induces oxidative stress, induces DNA adduct formation. Don't mess with DNA. You start messing with DNA, you can cause cancer, okay? Arrests a cell cycle. Cells cycle, you know, and they develop and then they die and new ones replace them. This stops it, freezes it. And here's what it targets. So, these range from extreme irritation, necrosis of the skin dies, necrosis, okay, to hemorrhage, exhaustion of bone marrow, and immunosuppression. When you go for a bone marrow transplant at a medical center, they're going to give you a mycotoxin-derived medication to suppress your immune system so you don't reject this new bone marrow transplant, okay? Just so you understand. Okay, so what do they cause? They cause mycotic infections, okay? Just like a bacteria or a virus, they cause an infection. Dr. Ponikow was the chairman of ear, nose, and throat, otorhinolaryngology at the Mayo Clinic. And he wanted to study what he said was the crud. What did he mean by that? Well, he meant by this chronic sinusitis that people get. And, you know, they take a course of antibiotic, it's a little better, and it comes back. They take another course, it comes back. I mean, it's this chronic rhinosinusitis. So he took 210 patients to the OR, stuck whatever it is up their nasal passages while they were under anesthesia, and sent the results to the lab. And he says, I want this lab, this microbiology lab, to find out what was in it. Was it a virus? What was the most common thing? Was it bacteria? If so, which one? Which virus? What was it? 96.4% mold. So he said, he wrote to the academy, said, we need to change the name from chronic rhinosinusitis to fungal rhinosinusitis. They rejected it. So he left the Mayo, and he's now at University of New York School of Medicine in Buffalo. He likes cold weather. Anyway, gives you asthma and gives you hypersensitive pneumonitis and other inflammatory disease, and it's cytotoxic, meaning it's toxic to all your cells. What else? Suppresses your immune system. It's toxic to your mitochondria, causes cancer, causes kidney disease, and the formation of nuclear and mitochondrial DNA adducts, and that's real bad. Okay, what else? Symptoms. You recognize these symptoms? There are a whole bunch of diseases that cause this, wouldn't you say? I mean, there's a whole bunch. So, I was at a conference. I was talking to Dr. Marvin Wentz. Nice guy. And I was with Dr. Vojdani, and the three of us were talking about the situation with molds. Dr. Wentz, way back when there was chronic fatigue syndrome, was the man who developed the test, he's PhD, who developed the test for Epstein-Barr virus. And everybody was getting tested for Epstein-Barr virus that had fatigue. And he said, but you know, there's strange things. The molecular structure, protein structure, for mycotoxin, molds, not mycotoxin, molds, is very similar to a bacteria. What's the bacteria? It's the bacteria that causes Lyme disease. What does that say? I mean, you know, we were surprised. Essentially, what that's saying is a person who gets tested for Lyme could actually be having mold and not Lyme, and a person tested for mold could not be having mold but be sick from Lyme. Cross-reactivity because of molecular structure. That's bad stuff. Because now a doctor, how do you do this? Which is it? I'm here to help my patient. Which could it be? So you've got to really be a detective doctor and ask, did you go camping, or is there a mold issue? Or, you know, you've got to really try to figure it out. Well, and incidentally, veterinarians are well trained in mold for pets, for animals, large and small. And I got a lot of referrals from veterinarians, believe it or not. Unbelievable. Okay, treatment, first and foremost. The first rule in toxicology is get the patient away from the toxin and the toxin away from the patient. What does that mean? If you've got chemicals producing things in your home, get rid of them. You don't want that. You don't want these scents that you plug in and makes the room smell good. You don't want to have one of those cans of I don't know what that you in your bathroom. You know, don't worry about that odor. It'll go away if you just wait 5 or 10 minutes. It's not that bad. It's much better than spraying it with floral I don't know what. Okay, second, in mold issues, you've got to build the immune system back up at the same time you've got to kill the mold. If you don't do the two, it's not going to work. And there's something else in all of these toxicities, not only mold, but chemicals and all that. No one treatment. There is no one size fits all. Every single person is a person. You've got to look because it depends on what they eat, what they drink, what they do, how active are they, how inactive are they, do they live in an apartment, a home, do they live in a townhouse, all kinds of things. Do they drive? They don't drive. Do they ride a bicycle? You've got to really find out about your patient. My patient questionnaire is 16 pages. My new patient intake takes 2 to 4 hours. So you've got to find out. You've got to be a detective. So let's talk about the microbiome. Remember that baby was developing the microbiome? What the microbiome is that these are these bacteria in the gut. And the gut is actually the size that down here, you see the gut? If you take your gut and spread it out, it's about the size of a tennis court. That's what you're carrying around every day, okay? And there's more nerve cells, which are called nerve cells, in the gut than in the spinal cord. So it's pretty important. It's called by some people the second brain. Okay? and it's continually and persistently exposed throughout life to food, liquids, and chemicals, right? All the time. Do you quit eating for a week and drinking? No. You'd never do that. You'd die. What else? We eat about a ton of food. So this ton of food has got to be processed, right? There's 9,000 taste buds on the tongue. We want things that taste good. Okay, what else? This bacterial community is kept in check by a very thin layer of cells. One thin layer. So it's, and there's little openings called tight junctions. Okay, but we won't get into that because that complicates things. Well, it makes it more interesting, but complicated as well. So this is continually exposed to these foreign materials all your life, all the time. And these bacteria are either beneficial and help you, or the opposite. They make you sick. Total number of the cells in the human body, 37 million. How many in the gut? 130 trillion. Remember, that's 130 with 12 zeros. That's a lot, okay? Then you have the human genome, 23,000 genes. That's what we're made up of, each one of us. Microbiome beats us way, way far. 8 million genes. 1 ml, 1 milliliter. That's about, you know, on a pencil, the eraser, the pink part on top, that's about 1 ml, maybe a little more. That ml contains more bacteria, okay, than there are humans on this planet. So you can imagine how many there are. Okay. So what does our immune system do? It helps us, it ignores all of your body's cells and tissues. Why? Because they're part of us. It ignores all that. These are the two jobs your immune has to do. The second one is examine everything else and decide if it's okay or does it need to be attacked and gotten rid of. Huge job. And we put foreign stuff in ourselves all the time. Inhalation, swallowing, etc. So let's talk about the brain. It weighs 3 pounds. So does the microbiome. Oh, uses 20% of our oxygen and calories for energy, okay? In newborn babies, it's actually 65% of the energy and calories go to the brain, okay? It has 100 billion cells, okay? They have, these 100 billion cells have about 1,000 synaptic connections. Imagine wires coming out. Every cell, 1,000 wires coming out of it, okay? Touching another cell, connecting. Pretty 100 billion. But what happens in the visual cortex in the back of your head? It's around 12,000 per cell. And what happens in the prefrontal cortex up here where you make your major executive decisions and moral decisions and things of that nature, what is good and bad? That's 80,000 connections per cell. Each of these firing every second. And transmission speed is 200 miles an hour along each one every second. Every person's thoughts, memories, emotions, actions, and reactions are activated via neurotransmitters. If you don't have neurotransmitters, nothing happens. What are these called? What are some of these called? Epinephrine, norepinephrine, or adrenaline, noradrenaline. We'll get into that in a little bit. But we know that there's a lot of problems when there's an imbalance of neurotransmitters in the brain, whether you're a child or an adult. Well, and let me give you one more. Every brain cell has to be fed oxygen and nutrients, right? Every cell in the body. So if you've got 100 billion cells up here, it's got to be fed. There's 400 miles of blood vessels in your brain. Okay. So the brain-gut axis goes both ways, okay? This is an example using tryptophan and serotonin. Tryptophan are the fundamental neurotransmitters. They're absolutely necessary for health. Tryptophan is an essential amino acid, which means you can't make it. You've got to get it from outside. It can cross the blood-brain barrier and participate in serotonin synthesis. The majority of serotonin is in the gut. What happens? Serotonin affects mood, sleep, aggression, sexual behavior. When you take Prozac or one of those kind of pills, they're known as SSRIs, selective serotonin release inhibitors. They mess with your serotonin, okay? And serotonin eventually is converted to melatonin. So if you're not sleeping well, it's because there's an issue with your serotonin. And then, where do you get your tryptophan from? Egg whites, cod, chocolate, dates, and red meat. Because remember, it's an essential amino acid. You've got to get it from the outside. Okay, so the microbiome generates a bunch of these neurotransmitters, okay? Dopamine, norepinephrine, serotonin, etc. And it changes the central nervous system, the brain, immunologically, biochemically, and hormonally, all three. I don't want to get into this. It's neurotoxin, a classical way is by taking ammonia. Ammonia builds up in people who have liver disease, for example. And then they've got hepatic encephalopathy. We don't need to get into that. Microbiome, okay, if there's a problem with the microbiome, you've got depressed mood, anxiety, impaired long-term memory, and reduced visceral pain thresholds. In other words, before you could tolerate up to a 6 in belly pain, say for belly, now you can only tolerate up to a 2. That's what that means. Okay, so let's look at nanoparticles. Nanoparticles are 1/1000th of a meter, and they're everywhere. Okay? We make about almost 16,000 tons of titanium dioxide, 3,700 tons of zinc oxide, and 300 tons of cerium dioxide. It's in drinking water. They use it in drinking water, toothpaste, cosmetics, sunscreen, and other products. And by the way, if you buy commercial toothpaste, and if you read very carefully, it'll say, if you eat this, call Poison Control Center. Okay. So, nanoparticles enter the gut, cause inflammation, and increased intestinal permeability. Ever hear of leaky gut syndrome? This is where it comes from, one of the places, okay? And they can cross go out through the gut because they're so small, and they do the same, and they can cross into the brain, which is not good, and they cause inflammation in the brain. So let's talk, last part of my talk, probiotics. I wrote an article on probiotics last year, and I was shocked doing the research. Okay, why? Well, it's about a $30 billion a year business. But all commercial yogurts are made with pasteurized milk. In the United States, you are not allowed by law to have any other kind of milk. It has to be pasteurized, okay? So yogurt is pasteurized after it has been allowed to ferment, meaning kill all the bacteria, right? Pasteurized. Louis Pasteur. Remember that? And then at the end, they add a little bit more bacteria at the factory, at the plant. They don't. So we're eating Chobani, Dannon, whatnot, and then they flavor it. Chocolate, strawberry, whatnot. A lot of these flavorings, artificial sweetener, okay, because it's got to taste good. The kids have got to eat this too, right? So, unfortunately, a lot of the commercial yogurts contain artificial coloring, all this stuff, including high fructose corn syrup, aspartame, which is equal. High fructose corn syrup. The US government published a study in Environmental Health Perspectives. They went into grocery stores, picked up a bunch of items that are the 20 most common items found in American households, but they had to have had high fructose corn syrup. Every single one of them tested positive for mercury. Every single one. Oh, okay. And by the way, the wise and knowledgeable people in Washington, D.C. know all this. I'm being sarcastic. I don't know if you caught that. Anyway, now, here's Reading University in the UK. Simon Cutting is the doctor who did this. And Simon did a study that showed that less than 10% of the usual commercial strains of lactobacilli and bifidobacterium and probiotics get to the microbiome. Why? Why, if I'm eating these probiotics, let's say I get a special probiotic that is only very natural, okay? What happens? Here's another one. This is in your end of the country, me being from Tampa. This is near here somewhere in California. UC Davis, 16 probiotics from local California stores. Check if the claims on the label matched what was found in the product. Only 1 out of 16. Can you imagine that? What kind of quality control is that? And in some products, there's a pill-to-pill variation in the same bottle. You know what's the worst thing about this? This was for children. Well, that's naughty. That's very naughty. Okay. Well, the vast majority of these probiotics say, oh, mine's better than yours because I've got more CFUs, colony-forming units, I've got more strains in mine, etc. But there is no scientific rationale. There are no studies that show that 200 billion is better than 10 billion, or that 15 strains are better than 5. It's just a marketing technique, okay? And most studies on probiotics, they're done on chicken and mice and various other things, are done with one single strain. They don't take what's actually on the bottle. They just take one of those and test it. And the quality of the strain is far more important than the quantity. You want to have and use a strain that has undergone DNA sequencing. So why can't you eat lactobacilli? Why doesn't it reach the gut? Why does normal lactobacilli bifidobacterium? Because once it hits stomach acid, it's destroyed. And if there's a few that make it through the stomach acidity, what's next? Bile acids. So really, these are modifiers because some of them help you for a little bit. If you've got bad diarrhea or something, especially in children, yeah, they'll help you, but they don't permanently help you. They help you temporarily, okay? And they're dead, I call it dead bacteria therapy because they're not alive, they're dead, okay? But this has been studied, and by the way, the end, since this is an evidence-based lecture, the end, there are several pages of bibliography, and you can get more, all you gotta do is email me. So this probiotic paradox has shown that, they has said it's really biological response modifiers or metabolic modifiers. They do not do what a probiotic is supposed to do. So, is there a probiotic that does work? Those that are based on spores, bacillus spores. Bacillus spores make it through all that. And they reach the colon, they germinate, proliferate, and resporulate. Studies have shown that, for example, Bacillus subtilis spores are immunogenic. They help your immune system. They boost your immune system. They disseminate to the lymph nodes and other Peyer's patches, which are part of the immune system. And Bacillus indicus, HU36, produce carotenoids. Do you know what those are? Lycopene, lutein, beta-carotene, astaxanthin. These are great for your body. Lutein is for the eyes. It's great for the eyes, okay? So you want something that's going to help you. Okay, what else can I tell you? They show the following. They help kids who have childhood allergies. They stimulate the immune system. They reduce the frequency of urinary tract infection in women. Some doctor specialists don't see this like dermatologists, but I have seen a lot of women who come and they have regular urinary tract symptoms. And now men are having the same issue. They're coming in and they think it's the prostate. A lot of times it's not really, but they go to the urologist and the urologist makes money off the prostate, not off urine test. So it decreases the frequency of these and of the bacterial cultures. So it kills the bacteria. Lastly, it helps in when you're taking medication for H. pylori, Helicobacter pylori. It helps mitigate some of those symptoms because those are 3 very strong, potent antibiotics. It's horrible to take. Patients hate it. Okay, what else can I tell you? It's great for small intestinal bacterial overgrowth, okay? Stops the diarrhea in children 3 months to 3 years old, and reduces irritable bowel syndrome. Irritable bowel syndrome, there's 2 kinds. One is with diarrhea and the other is constipation. This one is for the diarrhea kind. And improvement in pain scale in rheumatoid arthritis. They took a group of patients who had severe rheumatoid arthritis who basically sat in a recliner, maybe went to the bathroom, to the mailbox, to the kitchen, and to the bedroom. That's all they could do because they were in such pain even though they were on medication. 60 days later, they were walking 2 miles. Okay? That is significant. And that is inflammation. It reduced inflammation. Okay, so what kind of probiotic do you want? One that has DNA verification. It's got studies on each strain, okay, in clinical trials, not on chickens or mice. And it has to show it survives through the gastric passage and then colonize. And please, at least 1 human clinical trial, 1 human clinical trial, okay? Here's my references. Most important thing I can leave you, the reason I put this thing up here about probiotics is because I wanted you to have a take-home message to reduce inflammation, which is the center point of all this because we're constantly surrounded by toxins. Unless you go find an island somewhere, you're not going to be not exposed to things. You know, we all have to be practical. We can't live in a bubble. So help yourself by taking a spore-based probiotic. And there's one last thing I want to mention. The Dalai Lama, you know who that is? Okay. He was asked in an interview, what is the thing that you have learned in life that has most surprised you? And he said, man. Man surprised me the most about humanity because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he's so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as he's never going to die, and then he dies never having lived. I encourage you to remember that and live life. Thank you very much.
Okay, questions? Oh boy, hands are up.
The nanoparticles, is silicon dioxide, which is used in many supplements, considered a...
It's not a nanoparticle, but it's used it's an
Is it-
anti-caking device.
Is it safe for taking? Silicon dioxide is like,
I know. I don't like, it's basically sand.
but they're small particles and they
It's a
could...
small particle.
How do they... That
You know,
isn't covered by your nanoparticles, okay.
I try to use logic, but I also have to base myself on evidence. There is no solid evidence that that does this or that. There's some studies that say it doesn't do nothing, and there's studies that say, well, it does cause some of this in some people.
Well, the studies that say it do nothing are probably sponsored by the drug companies, so they're not
Okay.
necessarily
I don't
good.
consider, just so that you know, I'm the editor-in-chief for 2 medical journals. They're peer-reviewed and they're indexed. They're in PubMed. I have over 90 studies published in PubMed, including chapters in textbooks. I don't read, no, that's not true. I read stuff by the industries, either pharmaceutical, insurance, and I pay them as much attention as I do a roll of toilet paper.
That's what I was aiming at.
I don't mean to be so graphic, but I
That'd be
couldn't
really
help
nice.
myself.
That is,
So I look at it in the real sense, because what those people publish is pure, unadulterated marketing trash.
Where can we find safety studies on silicon dioxide then?
I don't particularly care to take something with that in it, but that's my choice. I don't have anything solid to tell you absolutely it's safe and absolutely don't take it. Makes sense. There's up there. Oh.
Thank you. Thank you. I've enjoyed this.
It's working.
Okay. At my house, I've got a bowl of tangerines, like the one over there I keep open, and every once in a while, one of them molds. Is this,
Throw it out.
Is this a problem?
No.
Do I throw them all out or
Just throw it out.
in the trash?
The mold is the kind that grows with water. Things that grow on things that you see readily and you just throw out, that's not a problem. You're not going to keep it as a decoration, are you? Okay. Yes, ma'am.
What's your view of VSA-3?
I'm sorry, what is my,
Your view of VSA-3?
I don't know what that
It's
is.
a probiotic from Israel.
Oh,
VSL, thank you.
oh, yes, no. If it's not spore-based, I've just showed you a smattering, because I've talked about so many things here today, but I could give a day-long lecture, and it would take 2 to 3 hours when I give it at conferences and in courses just on probiotics. And there's so many brands out there with so much hype, it's not funny.
How do you
And
tell?
with no evidence that they work.
How do you tell if it's spore-based?
You read the label. There's two companies that I know of. One, and this you can pick up on Amazon, for example, Amazon.com. It's called Just Thrive. And the other one is called Megaspore Biotic. I mean, there's a lot more information I can give you. You should all be taking vitamin K2. I don't have a chance to get into that. Yeah, okay. So, there's all kinds of stuff. But this is, invite me back and we'll talk about other stuff.
You're invited.
Thank you.
Next question.
How do you detox besides sauna and fasting or whatever?
Okay, how do I eat out?
Already exposed to a bunch of toxins.
That's a great question, especially for me since I've got a lecture in so many countries. I'll be lecturing in a short time at Oxford. I'm going to see what they're going to serve me there. I know I'll drink tea, and I'll have some biscuits, but I don't know what the, I'm afraid of bangers, their sausages, and all that stuff. So how do you eat out? Really, there is no effective way. Sure, the restaurants will show that this is organic, or this is gluten-free, or this is only so many calories. But there's no way, you wouldn't believe how much salt they put in restaurants because it got to taste good.
She actually asked
Those
about
9,000 taste buds.
detox. How do you detox?
How do
How do you detox?
Okay, I haven't touched on this, but one of the most important things you could do is walk. You don't have to jog, and sweat and all that kind of things, but walking. It's a great way to detox. Second, if you can afford it, get an infrared sauna. That's very healthy. Finns use it 2 to 3 times a week. In the United States, if somebody uses it 2 to 3 times a year, that's a miracle.
So you sweat.
Well, actually, with that kind of a sauna, you don't sweat as much, but you still evaporate a lot of toxins. You don't have, you don't have the sweat running down, but your pores will open up. What's the largest organ of the body, everybody? Skin. Thank you. all right? And you know how many bacteria on 1 square centimeter of skin? Not going to tell you because you won't believe me. But about 100 million. So that's our microbiome also, which I didn't talk about. Okay.
Maybe one last one on talking about, you point out something interesting about between the Lyme disease tick bite versus mold. Is there any way for it to be, I call it combination-wise, so that the doctor can
You could
figure out
have a
which is
combination. And I, in my personal opinion, and I don't have evidence, proof of this, what I call evidence. You call it proof, maybe. I had a patient. Her dad was head of an oil company an American oil company based in Moscow. An American, but working for the oil company. She was in a Shishi-Fufu college in New England. You understand Shishi-Fufu? Okay. For women. Top notch. Top notch. She went camping, came back. She was sick. This is New England. She was tested positive. They gave her antibiotic. Make a long story short, she eventually developed what is called chronic Lyme, and was on an antibiotic by the leading doctor in the world for Lyme for a year and 18 months on intravenous antibiotic, and she couldn't attend college. She had to quit, pull out. Said she'd be going back when she's better. They gave her a leave, etc. Eventually, Dad came and brought his wife and his daughter to me. And I said, was there this and this and this and this? No, she never had the bullseye, but etc. But she did feel temporarily better after the first round of oral antibiotics. And then she fell down. When I started questioning her, part of the time, yes, she camped out. The rest of the time, she was in these, in a camp that's only in the summer, open in the summer. Well, those camps and bunk beds, that kind of a camp where they have activity in the lake and canoeing and archery, and we've seen movies about that. Well, those cabins are notoriously leaky. I didn't have any evidence said they were leaked, but I had to use my judgment as a physician. And when I did, I tested her, and she tested positive for mycotoxins, not mold. I didn't look at mold, I looked at mycotoxins. She tested positive for IgG, IgM, and IgA antibodies to mycotoxins. I treated her. 2 months later, she was fine. Her father, to this day, calls me Dr. House. You have to use, every patient is different. You have to use judgment. Now, here's the bad part about all that I told you. There is no longer, in the United States, any blood test for antibodies for mycotoxins. That laboratory that's here in California, in Los Angeles, had to shut down that operation because the insurance companies got angry. I want to use another term. Why did they get angry? Because on one end, the insurance companies that insures houses and things like that, apartments, they were getting hit because people were saying, oh, it's the leak in this house you've insured that make me sick, you've got to pay for it. The insurance companies, the doctors, Blue Cross Blue Shield, blah, 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 United Healthcare, okay, said, oh, you shouldn't do this test, we're going to investigate you. So instead they shut down. Now there's a movement to open this lab in Mexico because their insurance companies in the United States can't touch anything. That is unfortunate though. That's the current state. All right, I better say goodbye. Thank you for listening to me, and you're a lovely group. And I'm glad you didn't ask me what causes ulcerative colitis.
Okay, we'll take a break till 5 after, and we'll be back here for second speaker on diet and health.